Turning now to some major COVID news, with the U.S. now reporting more than 10 million cases, a record 132,000 on Friday alone. This morning, we are learning of a possible breakthrough on the vaccine front.
Here to break down the news, NBC News medical correspondent, I should say, Dr. John Torres. Dr. John, always good to have you, sir. Thanks for your time this morning.
And great to be here, and my thoughts and prayers go out to Al as well and his family during this time.
Yeah. Let's talk about the Pfizer announcement that just came down a few hours ago, Dr. John, this morning. Their COVID-19 vaccine candidate, according to Pfizer, over 90% effective. Is this that breakthrough that we have been waiting for since March?
And Craig, this is actually really good news. And I think a lot of experts were kind of holding their breath, seeing how effective this vaccine would be, hoping around 50%. And the FDA even said 50% was the minimum they would accept, thinking it would get around that target. Well, right now they're saying 90%, which is really good news. But a lot of experts around the world are saying they're cautiously optimistic because this is preliminary news. There's still more studying and more data mining to do to find out how effective it'll be, not just short term, but long term as well. But this is a good sign that this vaccine, and hopefully the others that come behind it, are doing better than we thought they would do.
It certainly is a good sign, but what is the estimated timeline? I mean, you have to approve the vaccine, but you also have to distribute the vaccine once it's officially approved, which I'd imagine is a big challenge. I mean, even just getting enough vials to get all of that out to the American people, that's got to be a challenge.
And it's going to be a big challenge. And you can imagine here in the U.S., 330 million people, the vast majority of those are going to need the vaccine. And right now, it's on the timeline that most experts thought it would happen. Getting the emergency use authorization by the end of the year, maybe the beginning of next year. They're already starting to do production. They'll start distribution as soon as they get that EUA, that authorization. And then they'll start doing it in the phases that we've talked about in the past. First, the healthcare workers and those extremely vulnerable, and then going down to the general population. The general population, most of us, probably around April timeframe when we can start looking for getting that vaccine. But getting it this early and getting these good results, certainly good news.
Hey, Dr. John, before we talk about the trust issue, I want to go back to the 90% efficacy issue. Compared to the flu vaccine, 90% effective, what are we looking at here in terms of the comparison between the two?
And Craig, you have to remember, again, these are preliminary results, and hopefully they do pan out long term. But you're right, the flu, 40 to 60% effective, meaning that if you get it, your chances of getting the flu are 40 to 60% reduced. Here, we're talking 90%. That puts it kind of in the measles range, which is what we really like for vaccines, to get it into that 90% range. That means that it's going to be a lot more effective giving it to people, assuming people get it, of course, and that it can really help get this pandemic under control. So again, experts around the world cautiously optimistic with this news we're getting.
Preliminary but promising. Dr. John Torres. Dr. John, thank you, sir, as always.